Hello, my name is Terese Geraghty, and I'm a postdoctoral fellow at Rush University Medical Center in Chicago. Thank you for coming to my poster number 0573, entitled Characterization of Pain and Dorsal Root Ganglia Changes in Aging-Associated Spontaneous Mouse Osteoarthritis. We'll start with osteoarthritis is a painful disease of the synovial joints and is the most common form of arthritis. Management of OA pain remains poor and often relies on analgesics with limited efficacy. We know that onset of OA occurs mainly in adults aged over 50 years old, and aging is a major risk factor for OA development. In the literature, an important role for immune cells for OA pain sensitization has been suggested, but less is known in the context of age-associated OA. There are multiple experimental mouse models of OA that exist, but these are usually chemically or injury-induced in male mice, and yet only 12% of clinical OA is linked to post-traumatic injury. And therefore, the objective of this study was to characterize joint damage, dorsal root ganglia inflammation, and mechanical sensitization in a sex-dependent manner in mice of different ages. For our methods, we used wild-type C57 black 6 mice that were aged either to 10 weeks old, 6 months old, or 20 months old. Male mice were grown in-house at Rush University, and females were purchased from Jackson Laboratory, and of course our study was approved by IACUC. Mouse knees were evaluated for histopathologic analysis. As previously described, we used saffron and O staining. Mice were evaluated for mechanical allodynia by von Frey fiber testing, as seen pictured in the top right corner, knee hyperalgesia by pressure application measurement testing in the middle picture, and grip strength testing in the bottom right picture, all as previously described. For flow cytometry, we collected the lumbar spine level 3 through 5 DRGs, which are the knee innervating DRGs, pooled from 2 mice, and these DRGs were enzymatically digested. Cells were counted and stained before running through the LSR Fortessa flow cytometer, and we used FlowJo software for flow cytometry analysis. When mice were 6, 12, 18, or 24 months old, mice from the NIA aging rodent colony, we extracted their L3 through 5 DRGs and got RNA from them and loaded them onto integrated fluided circuits for automated PCR reactions, which was then ran on a Biomark HD platform from Fluidigm. For statistical analysis, we used students' t-tests for pairwise comparisons and ordinary one-way ANOVA for comparison of multiple groups. Starting with the knee histopathology, we saw that in 6-month-old males, there was very little, if any, fibrillation and loss of proteoglycan staining or cartilage loss. In the 20-month-old males, you can start to appreciate some fibrillation and proteoglycan loss on both sides, suggesting cartilage degeneration. In females, the 6-month-old females have very little fibrillation and cartilage damage. And the 20-month-old females, you start to see some fibrillation as well as some cartilage degeneration. When we quantified this using ORS scoring, we saw that there was cartilage degeneration on both medial and lateral sides in the males that was significantly more in the 20-month-old mice compared to 6-month-old mice. And the 20-month-old mice, we saw some osteophytes, but none in the 6-month-old mice. And in the females, we do see increased cartilage degeneration scores on both medial and lateral sides, but if you look at the scale, this is to a much lesser degree than in the males. And we saw osteophytes in both 6-month-old and 20-month-old females. So to conclude from this, we can say both male and female aged mouse knees showed increased cartilage degeneration, but to a much lesser degree in females than in males. And male mice knee histopathology is consistent with previous literature. We also looked at pain-related behaviors associated with age. And if you look at mechanical allodynia via von Frey fiber testing, we saw a gradual decrease in the withdrawal threshold of aged mice. So if you go from 10-week to 6-month to 20-month-old males or female mice, you see increased mechanical allodynia. For knee hyperalgesia, there was no difference between 10-week-old and 6-month-old males or female knee hyperalgesia, but both 20-month-old male and females had increased knee hyperalgesia. And for grip strength, again, we saw a gradual decrease from 10-week-old, 6-month-old to 20-month-old mice, a decrease in their grip strength. And so we can conclude that except for mechanical allodynia in females, 10-week-old and 6-month-old mice had similar levels of knee hyperalgesia, mechanical allodynia, and grip strength. Both 20-month-old males and females showed an increase in pain-related behaviors compared to 6-month-old mice. And these results are consistent with previous reports showing that aging is correlated with the decline in spontaneous locomotion in mice. We next evaluated immune cell populations in the DRGs of mice of different age groups using flow cytometry. We looked at CD45 positive leukocytes, CD3 positive T cells, CD11B positive myeloid cells, CD11C positive dendritic cells, CCR2 positive cells, Ly6C high monocytes, Ly6C positive, Ly6G positive granulocytes, Ly6C negative cells, which are antigen presenting precursor cells, and F480 positive macrophages. We looked at these populations in both males and females. We found that there were decreased CD45 positive leukocytes, increased CD11C positive dendritic cells, and increased F480 positive macrophages in the DRGs of both males and females. And only in females, we saw a significant decrease in CCR2 positive cells. And only in males, we saw there was a significant increase in Ly6C negative or antigen presenting precursor cells. We also looked at macrophage subtype populations that are typically categorized as either M1 or M2, M1 being more pro-inflammatory and M2 being more anti-inflammatory. The M1 markers we used were MHC2 positive or CH3CR1 positive, and the M2 markers were CD206 positive or CD163 positive. Both CD206 and CD163 are scavenger receptors that are typically associated with wound healing, and M1 markers, MHC2 is associated with macrophage activation and antigen presentation, and CH3CR1 is the fractalkine receptor that's typically associated with inflammation. And we found that in older male DRGs, there was an increase in MHC2 positive, CH3CR1 positive, and CD206 positive macrophages, but there was no change in the CD163 positive macrophage group, and there was no difference in any of these macrophage subpopulations in older female DRGs. We also looked at DRG gene expression in the mice of different age groups. Here we're looking at 6-month, 12-month, 18-month, or 24-month-old mice from the NIA aging rodent colony. And in females, we saw upregulation of certain immune-related genes such as CXCR4 and CCL3. And in males, we saw upregulation of immune-related genes such as CCL5, TNF, and CCL2, suggesting again that the immune cell populations in the DRG are playing a role in this in mechanical sensitization. So to conclude, mice of both sexes develop OA and have associated pain with age. This study demonstrates that aging increases the abundance of dendritic cells and macrophages in the DRG, which was in parallel with increased mechanical sensitization and spontaneous knee osteoarthritis. Evaluating spontaneous OA in aging mice may provide valuable insights that will hopefully lead to drug development of better analgesics for OA pain. Lastly, I'd like to thank both Rachel Miller's lab and Anne-Marie Malfait's lab for their help with all of this work. I'd also like to thank Tim Griffin for our wonderful collaboration and his lab's work on the DRG gene expression analyses. Thank you so much to ORS for allowing me to present my research this year. Thank you.